Good morning, everyone. So, thanks for letting me come today. I want to thank Haruv for inviting me to be here, and the interfaith community also as well for asking me to talk. I was asked to give just a brief introduction on child maltreatment or child abuse. And I didn't really know who my audience was when I was asked to do this, but I think I now figured it out, so hopefully this works for you all. So I do want this to be more of an interactive discussion. I have about 40-something slides. We don't need to get through all of them during my time. Oh. Thank you, see.
It was working like an hour ago.
Yeah, it was working perfect. There we go. We're on. No one sneeze or do anything weird. I would rather have this be a discussion. So if there's at any point anyone has a question, I'd rather us talk and you guys get away with the knowledge you want, not the knowledge I necessarily want to share with you. So we'll just kind of keep moving forward. Also, this is Albus, the doodle door. He is a therapy dog at the Children's Advocacy Center, which is where I primarily work. Is anyone have dog aversion or anything like that I need to keep him? Okay, so he will be off leash. He may kind of wander around. Also, another disclosure about this room, whoever designed it wanted the students to full attention on them if they enter or leave the room. So these doors are really loud when people come in and out, just to warn you. I've been lecturing here since the building was built, and it's one of my biggest annoyances. I don't know why the doors are not smoother. Just some basic disclosures. I have no financial relationships, don't attend to, this is all part of what I have to say from OU. But other things I just want to say is today's going to be discussing child maltreatment. So we're going to be talking about things like sexual abuse, physical abuse, and neglect. And I am aware that everyone in this room has their own trauma history, and you're coming into today with your own history. So some of this talk may be troubling or somewhat problematic, and I recognize that. And I just wanted to kind of bring that aware. So there may be some disturbing photos that we will be looking at. Not the worst of the worst, but just definitely something that's there. Also, there's a child and family in this that you're going to be able to see and recognize. They have signed a legal release with the University of Oklahoma, allowing us to use their story with my talk. So I have done that. I also decided to throw this in to give this space, my own faith disclosure. So you guys kind of know where I'm coming from. So I grew up in Wyoming, started in a Presbyterian church, and then we transitioned to a Baptist church, and I moved to Oklahoma at the age of 12, and my parents joined a Southern Baptist church here in Tulsa, where I basically stayed until I was about 18, you know, kind of that time period when you're like, I'm not sure this is what I really think. So as I went to college, I kind of transitioned out of the church. And really didn't get involved with any other church until I became a member at All Souls Unitarian Universalist Church. I started attending there and became a member at age 35. But now I more or less consider myself to be a humanist. That's kind of where I am at right now for my own spiritual growth, I guess. So, lastly, land acknowledgement. I just want to acknowledge that we are on the Creek Nation reservation right now, as we're here at OU Tulsa, but there's also historic lands that this land belonged to, and you can see all the different tribes that have lived on this land over time. So I do think it's important for us to recognize that we are on the Creek Nation reservation right now. So does anyone know who Dr. Vincent Folletti is? Raise your hands. We have one. A couple people in here. So has anyone in here heard of the Adverse Childhood Experience Study? Okay, so this is one of the core authors on this. So this is one of my favorite quotes of Dr. Folletti, and the reason I like it, it's because as a pediatrician and as a child abuse pediatrician, I use this to justify that the only real medicine out there is pediatrics. Everything else is just failed pediatrics. And it's because I think there's so much in adult medicine that is really just outcomes, negative outcomes that come from childhood. So this is why I want to kind of impart upon you all the importance of understanding aspects of child maltreatment, because all these adults are coming out and having adverse outcomes from what they may have experienced. So just to kind of touch base a little bit for those of you who don't know a lot about the Adverse Childhood Experiences study, this was done, nearly 30 years ago. There was basically an internist, Dr. Folletti, Dr. Onda, were two different researchers that looked at this. But they had Dr. Folletti had a clinic for adults who were experienced obesity. And he started recognizing a lot of his histories. There were these very similar type of past experiences the adults had, all related to child maltreatment. So he developed a pretty simple survey, a 10-question yes/no thing that was done in 2 waves. The first looked at just abuse and household dysfunction, and the second wave, neglect items were added. So within this abuse, he asked just yes/no questions. They're a little bit more than this, but like basically, did you experience abuse, psychological abuse, physical abuse, or sexual abuse? And these were kind of worded a little bit differently than just that. For instance, it would be often, did a parent or adult in the household often or very often ever swear at, insult, or put you down? For psychological abuse. For physical abuse, did someone push, grab, shove, or slap you? Or hit you so hard that you had marks or injuries? And similar for sexual abuse. And then also just kind of ask about neglect and physical abuse as well. And within the household dysfunctions, ask about if they experienced divorce or separation. I've changed it to the term I prefer, which is intimate partner violence, but the question was asked actually about domestic violence in the home. That's a term I use, an intimate partner violence, because domestic violence is a rather large umbrella term. So for the intimate partner violence, it's basically, did you witness your family members fighting in the home? Asked about substance use or substance abuse, mental illness, or criminal behavior. So the reason this was such a landmark study and important is basically Dr. Fletty and Dr. Anda and their team found that as your adverse childhood experiences increase, so you can start with 0, experiencing none of those 10 items, to 10, experiencing all 10, there is a logarithmic increase in adverse outcomes as adults. So increased risk for having adult-related illnesses like heart disease, kidney disease, liver failure, or having behavioral high risk factors like alcoholism or substance abuse, or just other high risk activities. And that basically increased to, and once you got to 4 or more adverse childhood experience, it just kind of logarithmically went up the scale for the risk for those. The A study found that about 63% of adults in their population had at least one adverse childhood experience, and about 12%, so over 1 in 10 adults have 4 or more ACEs. The A study was not perfect by any means. They were looking at a rather affluent part in California through the Kaiser Permanente insurance program. It was predominantly a white population, predominantly middle to upper class population. So since then, there's been other studies that have replicated it that have found similar, if not even more concerning results, like the behavioral risk factor surveillance study. And then also there's been studies done on children, asking them about their own experiences. So the ACEs study was basically asking people in their 30s, 40s, 50s, maybe 60s about what happened in their childhood. So there's going to be some recall bias in that. There's going to be some kind of perceptions of that found issues. But we have replicated it and shown that children right now being asked about it do have some very similar type responses to this. So again, this kind of goes into the health outcomes. So there's this dose response theory. So one thing I've been really careful about talking about is I feel like some people talk about ACEs and basically are like, if you have 4 more ACEs, you're going to be unhealthy and not well. And that's not true. So this is a generality, meaning that people in this room can have 5, 6, 7 ACEs and be healthy and not have a lot of this. People can have 1 and be experiencing some poor health outcomes. So it's really important to realize that this is not individualized. This is looking at a large, told you, that's really loud. And everyone looks over. Good morning.
Good morning.
You just proved my theory about how loud these doors were, so thank you. I guess it's not a theory.
Door open, so that doesn't.
Yeah, that's fine. Just watch him. He may wonder. That's
I
why.
will guard the door.
Thank you. So it is an individualized. It really is kind of the risk across populations. But it is important for us to recognize within the field of medicine and other type of professions that this is something that's real, and that we now know that there's increased risk of death. People with ACEs tend to die about a decade or so earlier. Yes, sir?
Can you speak more slowly, please?
Yes. I tend to talk fast in the morning, so I'm sorry.
I understand.
So people who have 6 or more ACEs can die 1 to 2 decades earlier than the average population. So they'll experience death in their 50s or 60s. So that being said, what I have found is that we need to really kind of focus not just on ACEs anymore, but there are so many other community factors and other traumatic and stressful events that we know also impact health outcomes in children and adults and our entire population. So some of the things we have found through studies is just other community violence. I would throw maybe school shootings into that. Bullying at school, when children and other people experience houselessness. When people have parental stress for any reason, economic stress, maybe something like a 3-year-long pandemic where people were out of work for an extended period of time and or having to find childcare because schools had to go to virtual learning. That falls into economic hardship. Racism, I think it's really important, particularly for those of us here in the Tulsa community, to understand the historical racism that's happened here with the Tulsa Race Massacre, and also the racism that's happened with our indigenous population going back 200 years ago or so, 150 years, I guess we can say. And this kind of goes into more of that historical trauma as well, that there are generations after generations who have experienced these type of stressful events, and we now know through epigenetics that this type of stress can be passed on from a generation to generation. So these are all important things I think we need to recognize, that early life adversity or adverse childhood experiences are well beyond those 10 key things that were found or that were researched in the study. So I'm going to transition here and just give you guys a brief introduction into what I think are kind of the 4 main core aspects of child maltreatment. And I'm going to start with just kind of psychological maltreatment. So this one's a little troubling to me because we just don't have a lot of data on it, in my opinion. It's something that is often not recorded as well. So most of the data we have on maltreatment comes from a large database that's supplied by the different DHS, statewide DHS institutions called NCANs. And they really don't code psychological neglect or psychological abuse well. Oftentimes it gets roped or kind of filed under physical abuse or some other type of aspect. So we don't have a lot of great data on this. And I think it's really a huge place where future research can kind of go. So the definitions are pretty simple. My current practice when I'm seeing kids is I think if you've experienced child physical abuse or child sexual abuse or child neglect, we can easily put this down as a diagnosis, right? And I think I have enough data, and I'm going to show you some of that to say why. So a child who's been physically abused or sexually abused has been psychologically abused and has experienced this. Psychological neglect is a little bit different. That would fall more under some of the categories of neglect, where kids are just not paid attention to, they don't have any support or attention. These can fall into several different things, different types of categories. So spurning, just constantly ridiculing the child, terrorizing the child. Probably one of my classic examples of this was a 5-year-old who I saw for physical abuse allegations of bruising on his shoulder from being hit with a paddle. He had those bruises. It was a classic physical discipline type injury. But during the course of my exam, I found several what I ultimately diagnosed as burn marks on him that were either paired about a 1/2 inch to 3/4 inch apart, or like a stellate, just kind of a star-shaped pattern. And during my history from him, I asked him about it, and he told me those injuries were from getting tased. And during the course of the law enforcement investigation and CPS investigation, determined that the perpetrator stopped using the paddle because it was bruising him and started using a handheld stun gun, and would just stun the child to the point to where he would incapacitate him and he would pass out. And then sometimes he would just get it, the kid would say, and just do the sound itself. So that would kind of fall into that terrorizing. Other things, isolating, and we see this quite a bit with our, I'm looking at Katie, who I work with kids who are locked in rooms, locked in cages and kept there and isolated from even their own family members. children who are exploited for different reasons, corrupting, asking the child to participate in criminal or crime type activities, just poor emotional responses, which can happen as well, and then neglect. So I do think we need to focus on future research on psychological maltreatment to better define it, and then also for medical providers to better diagnose it. I think my colleagues in like psychiatry and psychology probably, or specifically psychology, probably do a better job, but within medicine, I don't think we diagnose this as well. Moving on to child sexual abuse. So by the way, these are more or less in the order of how common they are. So psychological abuse is one of the least common diagnosed ones. I think it's very commonly happening, but just least commonly reported. Next would be child sexual abuse. This is the definition I use. It's just a very simple definition for child sexual abuse. It is an act of commission, which can include multiple different types of sexual contact, to include intrusion, penetration, molestation, or any type of genital contact, and other forms of sexual acts which children are used to provide sexual gratification to the perpetrator. So this is a little bit more of that inclusive list. So talking about voyeurism, fondling, so just watching the child get undressed, just touching the child, including over the clothes touching. I am so sorry for those who use trafficking. I have fixed this slide, I promise you. I don't use the term prostitution anymore, so I had to change that. I must have copied and pasted from the wrong presentation on here, so I apologize. So please know that that's not a term I use anymore in my normal language. I did fix the child sexual abuse material, so but that is a term I wouldn't use. I would use the trafficking of a child instead of the prostitution, sodomy, intercourse. So the reason I want to show you this is what we hear so much at our advocacy center is things were not being reported because it didn't include genital to genital penetration or genital to anal penetration. They're like, well, it wasn't sexual abuse. They just touched the child with their fingers. They just touched over the clothes. They just asked the child to touch them. That is still child sexual abuse across the board. So when we hear this, we'll find out about kids that have been experiencing child sexual abuse that was not reported because the individual did not think it fell into sexual abuse because there was not a penetrative act. And that's not the case. We diagnose it with any of these. And I would put this down as a confirmed child sexual abuse with this being part of the history. I think it's important to look at just kind of the statistics. Approximately 1 in 4, 1 in 5 females is the number we know have experienced child sexual abuse by the age of 18, and approximately 1 in 7 males are the numbers I use for this. Does anyone believe those numbers are high or low? So probably low. We're probably closer to 1 in 3 females and 1 in 4 males if we actually knew the data. The problem is we only know what we know. We only know what's reported. We only know when children disclose. And what we do know is children often do not disclose. I've had more than one case given a presentation similar to this where I've had an adult in their 60s walk up to me and disclose to me for the first time that they experienced child sexual abuse. So we also know this when I testify in child sexual abuse cases in juries that there will be a juror that will tell the judge or the prosecutor and other attorneys, I was sexually abused as a child and I've never told anyone. So it is an underreported, often missed form of child maltreatment. So I'm giving you the numbers we know from our data, but we don't actually have, we really don't know probably the full scope of children who have experienced sexual abuse. A couple key things for those of you who may not be medical, which I think, is there anyone here medical? You're a nurse, yes. Yes, 100% medical. So one thing that when I talk with children, males, females, non-binary, when I talk to families, investigators, is people have this misconception that a child will be able to come to see a doctor or a nurse and have an exam, and that provider can tell them whether or not they've definitely been abused. So it's kind of the misconception of virginity for females, and that's not true. So the most common finding, physical exam finding with sexual abuse, is a normal exam. And this goes for pre-adolescent children and post-pubertal children. So when we look at their anatomy, it looks just like it should. We don't see any signs of old injury, meaning scars. We don't see any signs of new injury, meaning like a laceration or anything. We just see a normal exam. Lots of reasons for that I can go into a little bit, but basically it depends on the timing of the contact. Most cases for child sexual abuse are being seen weeks, months, if not years later, so that tissue's had time to heal. It depends on the exact type of contact, whether it was more of an external type of contact or whether there was actual penetration, but even with penetration you have normal exams the majority of the time. And then the tissue healing, so the type of tissue we're talking about is a mucous membrane, much like the inside of your mouth or your cheeks. And this is for both, particularly for the female anatomy and the perianal anatomy. And anyone here bite the inside of their cheeks ever? Yeah? Does it ever hurt? Does it ever bleed? Do you ever have a sore there? Do you still have it there? No. Very similar concept for why we have normal exams. So I spend a lot of time because I'll have families or kids that think that a doctor will look at them and say, yes, you've had this happen to you because I can tell that your hymen's broken or something else. And that's not something. So we spend a lot of time just educating families and kids on their bodies and letting them know that their exams that they are okay, and no one will ever be able to tell by looking at them. So really what we have to rely on is history, what the patient discloses. And this is one reason why I'm a huge proponent of MDTs and children's advocacy centers and people who are trained to talk to kids with forensic interviews and let them tell their own story. So that is a huge part of what I rely on as a medical provider when I make my diagnosis. The child gives that disclosure and then let the professionals in investigation kind of do their job. So I think that that's important for you all to know, that if a child comes to you in your faith-based community or your other work environment and tells you something's happened to them, listen to them, believe them. You're not the investigator, you're there to support them. You then report that and let the investigators and the other people who are trained to deal with, to work with this, do their job on it. You don't need to ask more details to find out whether or not. You just believe them and trust them and support them through the process and move on. I did decide to look up, since I did a PubMed search. There's just not a lot of, there's some limited and mixed data really on religion and child sexual abuse, and I think Dr. probably be able to talk about this a bit as well. But I was kind of I knew a little bit of it, but I was really kind of disappointed that there's just not a lot of out there. But I wanted to kind of just go through some of the stuff I looked at and just kind of talk about some of the major things we've seen, particularly here in, that have happened. But when we look at faith-based communities and child sexual abuse, we noticed that this is not even a month ago. This was an article that came out about the Baltimore, from Baltimore, of decades of hiding abuse. So we know that it's occurred there. In 2020, 21, did anyone read the Houston Chronicle 6-part series looking at the Southern Baptist Convention and abuses that have occurred through there? This is a really well done, in-depth thing. I think it is 6 parts that you can go through and look at. And I just found it really intriguing, because they kind of go back and find about all these reports of abuse that have been happening for decades that were not reported, or within individual churches, they would fire an individual for it, but then they would not, that person, there's no central database, so that person could then just go to a church in another county, another state, and start working, although that they had been fired for some sort of sexual abuse allegations. Getting a little bit closer, there's a large camp here that's run by the Southern Baptist Convention called Falls Creek. They had a lawsuit due to abuses occurring on their property and the different leadership there not responding appropriately. And this next one is a little kind of troubling, but even our own senator here from Oklahoma, who was the executive director of Falls Creek around the time that some of this happened during a deposition, stated that he believes that 13-year-olds can consent to sex with an adult. This was something said in deposition in 2010. As someone who believes in, being an advocate for children and a little, I wouldn't say politically active, but I have called the senator several times, the office, about this statement, have not received a reply. I don't think he's ever actually further explained or retracted that statement. And this has led to faith leaders in the community speaking out against it, which is good, right? People who are concerned about that, actually speaking out and concerned about camper safety and advocating for the children in their program so they can make sure that they can go to a safe place. And probably the one of the most closest to home here, and for me, was about 10 years ago, was Victory Christian, had a case where a child had disclosed being abused by someone who worked in the church, and the leadership within that faith community chose to bring the child and the perpetrator together in a prayer circle and pray about it rather than report it. And then she ended up being the child that had subsequent abuse later. There was a lot of different things even here that close to home with us. So this is something that does happen in our faith communities. But I would also say that I have seen and heard wonderful stories from children and families who've talked to me about how their faith community has helped them through the process. And so I'm bringing up the bad stuff, but letting you guys know that I am fully aware that there's much more good out there as well. But we have to acknowledge that there are things that are happening that we need to address within our communities. Am I still talking slow enough? You guys caught me like on my peak caffeine kick.
It's loud enough with the back. You should
Yeah.
pass, baby. You need the mic or not.
Am I still loud enough for the back? Okay, great. So briefly, I just wanted to talk about child physical abuse. And this is something that I still think the faith community can see and deal with, particularly if you run like a child daycare in your organization, or you're involved with other kids, particularly as a member of All Souls. I was a member of the Children's Religious Exploration Board, which I basically went and helped kids and families from 9:30 until 1:30. And it was one of those things where I did some trainings with our board at the time to help them recognize some different things for physical abuse. This is kind of a huge definition of physical abuse. So the simple one I use is when a child sustained an injury at the hand of a caregiver. So it's much more simple. It's just, but child physical abuse can be multiple different things. Being hit with an instrument. We have our baby Hope over here, who would demonstrate what an abusive head trauma case could look like. So like a type of shaking, kids who are burnt, bitten, strangled, immersion in water, and it has to result in some sort of tissue injury, right? So either a bruise, a broken bone, internal injuries like brain injury, or other intrathoracic or intra-abdominal injuries. So we are going to be looking at some photos. So I want to warn you, there are some photos of kids that experience abuse here, but the reason I want you guys to see this is because if you're out there in the community and you may see some of these things, I want you to be able to identify it and kind of know what to do, but also just to recognize some of the more common things that we see that are missed in the community that we then end up seeing later where the kids have worse outcomes. So just first, what injuries do you see on this child? Yeah, a little bit of bruising underneath the left eye, scratch on the forehead. Anything else?
Her nose?
Yeah, some abrasions around the nose. Yeah, that's good. How does she look to you? Scared? Okay. So by a show of hands, would you say that these injuries on this child are abuse, not abuse, or don't know? So let's say abuse. Okay, maybe 4. Not abuse? Don't know? All right. Hey, you raised your hand twice. You changed your mind? Okay, I appreciate that. I say the same thing, is I'm always willing to change my mind with more information. And so for those of you who said don't know, thank you. You need more history on this. But this is the difficulty of my job, is these are the kind of kids I see. And this very well could be an abusive injury. Someone could have hit this child in the face, causing her to fall, causing the abrasions. She could be scared because she's been in this type of environment where her brain's constantly stimulated with cortisol and other stress hormones. Or she could be a child that fell and just bruised her eye. Depends on her age or developmental level. But for those of you who said definitively abuse, I will say this is my daughter when she was 2 years old. So thank you for that. She is now a healthy 16-year-old. But I'll tell you how she got the injuries, and this is what we should ask parents when we see this, is she was 2, we were at St. John's Health Plaza, which has a therapeutic pool in it, and we were teaching her to swim, at family swim on a Saturday morning. And what we were doing is teaching her as she touched the bottom to be able to bounce up, so she thought it was fun. I would just hold her and she would go under and bounce up. This particular time she bounced up and went at an angle and hit the bar that people will hold on to going underwater in therapeutic pools. And there was about 20 other adults in there, about 25 other children, and you heard the bong, and she came up and she did that 30-second silent cry, and she had immediate contusion on her cheek. 30 seconds later, she had stopped crying and we were swimming again. The same day, of course, because that's how things happen, we went to my niece's 6-year-old birthday party. She was upstairs with the other 6-year-olds, and they were running around like a coffee table. I was downstairs helping just kind of clean up, and my niece comes running down going, Uncle Monkey, Addie hurt her head. And so me being a pediatrician, I was like, oh no, this is bad, head injuries are bad. She had been pushed down, of course, fallen, got the little scratch on her head, cried, was fine. The abrasions on their nose is this was January when she was 2 and she was in daycare, so constantly blowing her nose. The reason she looks like that, and she's given me permission to say this, is because she's a ginger, and this was about 10:30 at night, and Dad had the camera out, and she was done. This was all we saw. So I've seen this look on her still. She has not lost this look at all as my 16-year-old. But this is the importance. When you see these injuries, just ask if the child's verbal, how did you get your owie? If the child's not verbal, ask their caregiver, hey, do you know how they got this? And if it's something that just doesn't seem developmentally okay or just excessive, report it, do something. So these are some examples of times when kids maybe not been reported and end up having more severe injuries. So this is a approximately 4-month-old that had these 3 small bruises. So nothing huge, nothing major. If you saw this on a 3-4-year-old, well, on the chest you'd probably be a little bit more concerned. This baby was a sibling to a child that had other physical abuse injuries that I asked to bring in. The CPS worker had told me they'd done a diaper check and there were no injuries. And during my exam, I found these 3 small bruises. I followed a national protocol and got a head CT, basically x-rays of the brain, which was fine. But I also did 22 x-rays of her entire body, called the child's entire body, called the skeletal survey. And we found 5 to 7 healing rib fractures on this child. So I saw someone, so this was probably a child that nearly experienced an abusive head trauma shaking type event with being squeezed around the chest. But a lot of people would see those and not really think much of them because they're tiny bruises. So one thing I teach other medical providers, but you guys can understand, for those of you not medical, but if you see bruising on the torso, ears, or neck on any child less than 4 years of age, or any bruising on any child who's not mobile, that's concerning. If you see injuries in the mouth on something called the frenulum, that little piece of tissue that connects your gums and your tongue, that's concerning. Angle of the jaw, kids don't really bruise there that easy. That can usually be a grab. Soft parts of the cheeks are always concerning. Bruising on the eyelids are concerning. Subconjunctival hemorrhages or blood in the white of the eye would be concerning, or any sort of pattern injury. So the mnemonic for this is 10-4 facies P, which is a little much, but just think of those weird places for bruising. Now, I'm not talking about toddlers getting bruising on their shins, but toddlers getting bruises on the inner part of their thighs, yes, that would be concerning. Some examples here, bruising on the eyelid, this would be concerning. You can also see the child has a small little tongue laceration as well. And some what are called petechial bruises on the face. Bruising on the ears, always concerning. This can be a slap or pull or grab. It doesn't show up as well in the photo. Let me see if I can get my mouse over there. But can you appreciate there's some yellow discoloration here? So that's bruising on a part called the mastoid bone, which can be indicative of intracranial injury, called a battle sign. So that child would need to have a thorough neurological exam with x-rays. This would be a fairly classic slap mark that you could see on a child's face from being slapped. You kind of see the outline of the hand with the fingers here. Again, bruising here, and you can see how, because slap marks would go along the angle of the jaw and actually bruise the neck. So this would be something fairly simple. This next one's probably going to be the worst physical abuse photo I show you, but I want to show you something that can be on the more severe side, and also the importance of why we need to see these kids. So just to caution you on that. But this would be something that we see with kids that experience more severe physical abuse, with being struck with a flexible instrument like a cord or belt. The importance for me on this one is, had no one looked more maybe at this than just this child's arms, because this would have been in the winter, so more or less elbow down was the only thing uncovered. There was a small mark on near the wrist that drew someone's attention to it. I was able to see her and do our exam. You see the extensive amount of bruising on their buttocks. Bruising on the thighs was there as well. So this child actually got admitted to the Children's Hospital for 2 days because she had so much injury that she actually had muscle breakdown. We wanted to monitor her kidneys and monitor their kidneys and give IV fluids. But this would be an example of someone using physical discipline on a child that is completely excessive. So, when should physical abuse be considered? I'm going way over.
Oh, you're good. You have a scale of 10. 10 or 5.
Okay, yeah, we'll see. But this
10.
10. We did start like 10-15.
Yeah.
So history should be given by the parent. We should be concerned when the history does not match the injury. If the child kind of gives an unbelievable explanation for how they obtained their injury, like almost magical. If the child just reports an injury by a parent or another adult, if they say they don't feel safe in their environment, or there's just inconsistent with developmental age. So those would all be kind of key things I would consider for physical abuse. So again, relating back to how I've seen the faith community and religion impact with child physical abuses. Anyone ever heard this? Yeah. So Proverbs 13:24 is quoted to me all the time. So for those of you in the faith community, or particularly the Christian faith community, does anyone know what Proverbs 13:24 actually says? Give you a hint, it's not this. This was something that was created back by Samuel Butler in the 1660s, and it's now been kind of used to justify physical discipline towards kids. And it's something I hear routinely when I'm talking to families about not using instruments on their children. I kind of dug in and did a little bit of research on it, just looking at different things. But again, I have that faith-based community in the Christian church in the Southern Baptist. There's something called Awana in Wyoming that I was part of. But when I go back and look at it, this is not how I interpret the Proverbs 13:24, which actually says this. For me, Proverbs 13:24 and other things that talk about the rod are actually just talking about teaching, right? They're talking about discipline, which is, the root word is disciple, which is to teach. And when you kind of look back at what was done at the time that this would have been written, which Proverbs is also like poetry, right? It's not like a verbatim type stance. They actually talk about using a rod to guide and teach, like shepherds would use that to guide their sheep. They would not hit their sheep, they would kind of put it in front of one side to guide them to the other. And so if you kind of look at this, a lot of what this has now been used to is really what I try to teach families is, yes, you should discipline your child, but discipline is teaching, and teaching them how to be a fully functional human in society. And that's not, when you get angry, running out and hitting someone. So this is one thing I see a lot with, that people bring their faith into when I'm seeing them, and they talk about this. So I'll kind of talk to them about how I interpret that, and ultimately just give them the evidence base behind it's never okay to hit a child, that physical discipline causes more harm than good. We have plenty of evidence that shows that. Just quickly, so the most prominent form of child maltreatment is child neglect. Year to year, when we look at overall child maltreatment, child neglect is 75 to 80% of all child maltreatment. And I think that's important to recognize because neglect can be very subjective in how people talk about it. So there can be lots of different ways that people may label neglect in one area but not another. It's also an act of omission as opposed to commission. So people just don't do something for their child as opposed to doing something to the child. This is one of the more difficult ones for me. The most common ones I see would be medical neglect, basically kids not being taken to the doctor on time, failure to thrive, or kids have nutritional neglect where they're just not thriving for some reason. But this was one I think would be hard for you all in faith, because there's probably families that come in that, you know, they need help. They need help with groceries, they need help with housing, and they need help with all this stuff. Is that neglectful that they can't get that, or is this more of a societal neglect and institutional neglect that we're not actually providing those services to the families? So I think that when I talk about neglect and religion, how it comes to interplay with mine, this is a policy statement from the American Academy of Pediatrics. And this was in 2013, it was reaffirmed in 2020, I believe. But the big thing that I see with neglect and how it interplays with the faith community directly is when people have religious exemptions for the different things that they do for their children. This policy statement actually recommends getting rid of those exemptions because it really does create some disparity in communities. So there's some religious beliefs that, you know, you just pray for the child, which 100% have no issues with that. But when I had to see a child and do a case review on a child that died from new onset diabetes, type 1 diabetes, because the community just prayed over them as they died over a week, that was concerning for me, particularly when other members of that faith community were seeking medical care for themselves at the same time. So there are lots of issues, and we've looked at this from the American Academy of Pediatrics, and I do recognize that when people come in with their faith and that if they're wanting to do a certain type of treatment, and as long as that's not going to cause harm to the child, I'm 100% behind it. It's just I would have to intervene from my standpoint if I feel like what they are wanting to do for the child is going to ultimately end up in causing them harm. The court systems have also kind of followed that as well, is that they've recognized that adults have the autonomy to make those decisions for themselves, but that child does deserve a different type of protection. So, any questions on the 4 basic forms of child maltreatment? If I have till 10:15, I will finish. Yes, sir.
Can you say more about some examples of religious, the one on slide now? Just
So, I mean, specific examples?
no, just examples of what. Yeah, examples of religious exemptions, how far they go.
So, yeah.
And some that, you know, obviously we don't want to look at, we're just praying for the child and nothing else.
Right.
But I feel like it probably goes a little deeper than that.
Absolutely.
Can you say a little bit more?
Yeah, so I'll tell you the examples I've experienced with one particular faith would be the Christian Scientists who don't believe, and that was the case with my family that had the child that died. Leaders in the faith community did not allow the parent to take the child in and insisted that if they did, the child would go to hell. But then they also allowed the mom or the caregiver, trying to be non-specific, to seek medical care of their own for some different issues, which kind of caused some issues for me. So this would be a case where it was okay, but there's a point where the child was not even breathing appropriately. And what the courts have found is those are the times where you then need to seek medical care for the child. So it wouldn't be like if a child had a sprained ankle and no broken bones or anything like that, and they just wanted to pray over it to help it heal, instead of maybe giving Tylenol or ibuprofen. Other ones, I believe, again, this is not my expertise necessarily, but I believe the Jehovah's Witness faith does not believe in certain types of blood transfusions, and courts have, again, ruled in favor of the child to receive some of those in life-threatening situations. So those would be probably the 2 big examples and ones that happen most commonly. Vaccinations have become another one for religious exemptions, and that's been a whole, you know, with the COVID vaccine coming out, a whole new thing that is kind of happening. So, and that faith-based exemption has been used fairly broadly. I don't think there's any particular faith that is the only one using that. Is that helpful?
Yeah.
So what I wanted to do is transition, because I kind of mentioned about adverse childhood experiences. And as a pediatrician, I grew up kind of cutting my teeth on this. I started in 2005 with my training. It's just a few years after the ACEs came out. My mentor, Dr. Robert Block, introduced me to Dr. Folletti at a meeting here, so kind of got on that. But what I have found is it's been kind of taken, as I mentioned earlier, and people are using that as kind of an excuse to blame patients for their problems in some ways. So I wanted to kind of focus on why I want you all to understand the importance of child maltreatment because of the long-term outcomes and impact it has on kids. And I'm going to do this through talking about toxic stress. So for those of you who've gone through pretty much any college education, you've probably done some sort of course or biology thing where they talk about the stress response. Have you guys heard this? Fight, flight, or now that we have freeze. Have you guys heard of all that, right? So this is the thing, like right now, if a lion walked in here, we would all experience one of this. I don't know what I would do, to be honest with you. But we would all kind of have that. We either run, we either fight, or some people just freeze. And this is important to know because it causes changes in your actual biological systems. Your blood circulation changes, so if you're going to run, you're going to start getting some different blood to your muscles. It's going to divert blood from your intestines because you don't need to be digesting food right then. Your respiration, you're going to increase your respiration. Your metabolism changes. Your body starts breaking down something called glucagon, which is stored sugar, to give you some more of a sugar rush. And this comes from different components in the blood called cortisol, norepinephrine, and epinephrine, right? So all these things are good. We want this because, like I said, right now if a lion came in here, we're all going to react differently, and we need to be able to do that. By like just evolutionary, that's something that's happened. I don't know what Albus would do. I think he'd be like, hey, it's my new best friend. So that would probably help me on how I react. So this is kind of a little bit sciencey, but basically what we know is, again, cortisol, epinephrine, and norepinephrine. And when there's a stressor, your brain, particularly the amygdala and the locus coeruleus, cause a release of different hormones. It impacts the hypothalamus and pituitary gland, which releases other hormones. And then these other ones come out into the bloodstream. And cortisol is important, and it releases some of those sugars. Epinephrine and norepinephrine impact your breathing and your blood. And there's supposed to be a negative feedback, right? This is how things work. So it should be that if you are experiencing stress, you have it for a few minutes, and then you have a chance to calm down because you have a negative thing. What we have found with kids who are experiencing child maltreatment is this is happening every day. This is happening every time they experience abuse, whether it's physical abuse, sexual abuse, or neglect. So these hormones and these epinephrine and norepinephrine and cortisol are wreaking havoc on their bodies, on their brains, on their heart, pretty much every system. So when I think of the stress response, this is kind of how I think of it, is on a continuum. You have positive, tolerable, and toxic. So positive stress is good for kids. We want kids to have some positive stress. We want them to be able to overcome some adversity. So taking a test at school, maybe giving a speech at school. Different things like that are good. It gives those brief activations, but then they have a chance to calm down. Tolerable or a little bit more concerning. So maybe like the pandemic, a natural disaster. So it is something that is more prolonged, but is relatively short term and doesn't necessarily cause long-term issues. When we get into issues that are bad, it's when we get toxic stress. And this is where you see the abuse, neglect, household dysfunction. And that's because this prolonged impact actually just does disrupt their biology and their physiology, can actually impact their anatomy in some ways. So there's several different things. It can impact the neurological system, psychiatric, how they behave. So this is one thing I talk to families about. If a child's experienced physical abuse or sexual abuse, and they're at school, and someone says something that seems threatening to them, they may jump up and run out of the class. And teachers and educators may interpret that as behavioral problems. I interpret it as a stress response that's probably built into their system. Endocrine, we see obesity, and also the opposite, kids who are malnourished, and other metabolic. Cardiac, it can impact their heart. Reproductive systems, as they become adults, can be negatively impacted. Immune system, inflammatory, and genetic. So basically it impacts how their white blood cells interact with infections. So they're prone to infections, they're more prone to getting arthritis, and then actually the genetics, through epigenetics, they can pass that on. So with all that sciencey stuff, that's great, but what I want to do is tell you the story through joy. So this is Joy. Again, her family has consented to allow me to talk about her and show photos of her. Her parents actually shared every photo that I have with her with me. So I want to introduce you to Joy. She's one of my greatest failures as a child abuse pediatrician, and she's also one of my greatest successes in some way. And so the reason I say that is I first met Joy. She was under a different name. I had diagnosed her with multiple forms of maltreatment or neglect, nutritional, environmental, and emotional neglect. I was working with the family at the time to kind of help her. She was 9 months old or so. And for about 2 months, they did pretty well, and we were seeing some progress with Joy. And then they just disappeared. And because at the time I was busy, I didn't follow up and try to find them. The CPS worker also had signed off the case to a permanency worker who lost the family. And so we lost Joy at that time for a while. And so when I met her again about 18 months later, when she was approaching 3 years of age, her situation was dramatically worsened. And so what I hope to help you understand is how stress impacts kids by telling you a bit about her story. So let's start with the good news. Joy now is doing well overall. This is a screenshot of a video her mom sent me when they were in Costa Rica, or excuse me, another Central American country. It wasn't Costa Rica. And she got to meet a sloth. So what you can't see in the still frame here is in the video, she's being handed this sloth. And you see this apprehension. And you see her just kind of do this, and you see her look at her family, and she looks a little frightened. So that's kind of where we're at now. And immediately after this, you see her just get a huge smile and this huge sigh. And she kind of had that positive stress, right? She was nervous about having a sloth handed to her, but it really did, you can hear her parents encouraging her, you can hear her laugh, and she really does kind of have a joyfulness about this experience. And this is a good type of positive stress that we know is important for kids. Again, it's infrequent, short-lived, and it's there having a supportive caregiver to help them along the way. And they provide buffers like reassurance and protection if needed. And we want that because it helps them gain motivation, it helps them gain resilience, and so they're benefited from this. This is a little bit more difficult time for Joy. She's younger here. This is more tolerable stress. This is shortly after I met her for the second time. So she was undergoing chemotherapy because she was diagnosed with acute lymphoblastic leukemia, and that's what she had presented with. So she, at this time, had a foster family. That's her foster dad, now her dad, Jeremy, who was there at her bedside the entire time. He shaved his head, so because she had been losing her hair. Jeremy and his family had started a nonprofit for families who were having children going through cancer. And they found out that Joy was more or less had been abandoned by her biological family and immediately signed up to become her foster family. They'd never fostered before, but they had a child with cancer, and so they knew kind of what they were going through. So this is tolerable stress, and this is the type of stress that kids have with the death of a family, like a death of a family member, maybe a divorce. It's a little bit longer lasting, but hopefully once the stressor is removed and with some time for healing, their condition can improve. Overall, biologically, the organs and the brains do recover. Now, I'm using her example with cancer, so the cancer is going to impact that, but the stress she's going through, maybe not as much. That's opposed to this. So this is Joy when, I saw her again for the second time. She was about 3 years of age. She had been kept with her biological family who had lived in the same place for about a year, and the landlord did not even know that Joy existed. They did monthly checks through the house. They didn't know that there was a child there because Joy was kept in a car seat in the closet. Ultimately, someone did find her. She was rushed to the hospital. She was put on life support, and this is the condition she was in. It's when she was diagnosed with leukemia, and really, I didn't know if she was going to live through this. But she did. We were able to get her nutritionally in a better place, and she ultimately was able to come out and receive treatment and has been in remission for several years. So this is toxic stress. She had no one there to help her. She was just depleted. She was experiencing the stress day after day, hour after hour, minute after minute during that entire time. So her body never could return to that normalcy that she needed. And so this is very similar to kids who experience other types of maltreatment, physical abuse, sexual abuse, or neglect, and the adversities that they have day after day. So these are some other, just kind of showing the progression of what happened with Joy. This is Joy's mom, Amy. I will tell you that I came really close with this family. I treated Joy therapeutically for about 6 months after this, but then remained in contact with them. And I will tell you that their faith played a huge part in what they did with Joy. They relied on their faith community. Their church was there for them. If you've ever had a child undergo chemotherapy or be in the hospital, you need more than just 1 or 2 people there. So this is what they kind of experienced through that. I can only think about, as I think about Joy and the toxic stress, is what she experienced during that time and all the impact it had on her body and how that probably led to her ultimately having cancer because of all those things I kind of mentioned earlier about the stress response causing that. So this was her. She kind of was getting a little bit better. And then kind of moving on as we do, the family then chose to adopt Joy, or she chose to adopt them. I don't know which way, but they, this is a picture of her gotcha day, where they brought her into the family. Again, just amazing what they kind of did, and it just shows that Joy having a safe, stable, nurturing relationship is going to improve her outcome. So, in the interest of time, because I know I only have like 2 minutes, so I just want to kind of end with what I am looking forward to now is we look at toxic stress and adversity, and not just talking about ACE scores or biomarkers, but it really does, we can miss out on opportunities to talk about relational health that promotes and flourishing despite adversity. So this is where I think the faith community can really kind of come in and play on this, as we talk about toxic stress versus relational health. So I kind of mentioned toxic stress, but relational health is really what I see as a key to helping with child maltreatment. And that is having a safe, stable, nurturing relationship. That's what SSNR stands for. That within the individual, family, and community capacities, the faith community, for example, to support in the development of a child. This helps buffer adversity and builds resilience across the life course. And this is what I see as a huge future and a huge possibility for the faith community, particularly in Tulsa. A safe, stable, nurturing relationship doesn't need to be a biological parent or a biological relative. It can be a pastor, a youth pastor, someone at the church or the faith community that is there to help that child along. It just needs to be a safe, stable relationship that they can have. So this is my last thing for Joy. She's doing well. This is the most recent family photo that they had. With the help of her family and her community, she's become an active, funny, and truly joyous child. For me, she shows that the work that we all do is worth it, and helping her during this time and seeing how it happens when a child has that safe, stable, nurturing relationship provides me with a single case study of proof that the recommendations to have that do work. And I do know that the families relied on their faith and those in their faith community to help them to this point. I also know that Joy will continue to have issues as she transitions to her teenage years and young adults. She'll continue to need resources. She's in a lot of special classes and does a lot of different therapies, but she's still improving day to day. So I had a final thoughts, but I think I am out of time. So those are just kind of some of the things I've reflected on. Oops, I misspelled religion. Love that. But I do think that ultimately faith groups are an important source for children and families to mitigate the impact and prevent toxic stress for those who experience child maltreatment. And with that, I'll take any questions, or you guys can show me the door, the very loud door. Thoughts, questions? Yes, sir.
So you had sort of alluded to this toxic stress basically compromising the immune system.
Yes, sir.
And a precursor to cancer. Is that
Yeah.
Not only cancer, but all kinds of physical maladies.
Yes.
Recent research has identified, right?
Yes.
Cardiovascular disease,
Absolutely.
liver, kidneys, all of it, obesity, right? Tying back to that toxic stress in early childhood.
Correct.
Yeah.
Yeah, and I think, cause I talked about ACEs initially
Yeah.
to start with, I think we really can look at toxic stress and how these neurohormones, cortisol, norepinephrine, epinephrine, amongst others,
Yeah.
all cause that, because it's causing those consistent, and it's the toxicity of it that's the issue, right? So
Right,
it's
'cause
just the
for a
constant
long
hits.
time, we only thought of it as affecting people emotionally.
Correct.
And then, of course, behaviorally because of the emotions. But now, the physical impact is
So that's, it's interesting because I look at, I know I'm going over my time, so I'm sorry. You guys can take it out of my whatever.
how do you check?
Sure. So one thing that my mentor, Dr. Block, really stressed with the American Academy of Pediatrics during his time is changing how we look at mental health and stop calling it mental health and calling it brain health. The brain is in your body. It's a physiologic, it's anatomic. It responds to things the same way the heart does and everything like that, right? But what we've done in medicine and other fields is we've separated it. So like what you're saying is they talk about mental health, that it's something outside of you, but it's actually brain health. It's something that's happening internally. And now we know through all this that it's caused by a lot of these different types of issues. So for me, I'm advocating hopefully that we start looking at mental health or brain health as something that should be fully included in health services for an individual. But we have a lot of advocacy and policy changes to make that happen.
I think you bring up a good point when it's specific to the faith community. I know we see it's been, I won't say across the board, but historically taboo for people in the faith community to get any kind of help for depression or
Yes.
this kind of thing. So to make it distinct too, it's a physical part of the body
Yes.
that's experiencing this. Why would we not go get help and treatment for it, right?
100% agree.
Like we would if we had or something like that. So I think that's important.
Yeah,
for the
and
community to remember.
that was something, I looked at some research on how child sexual abuse in the faith communities interact, and there's really a lot of mixed data on that, meaning that some individuals who experience child sexual abuse, most of the studies show that they actually step out of the faith community they've been in. They lose that, and because they feel oftentimes betrayed. But there's some showing that they do have maybe a stronger connection to it. But I think it kind of goes back to how that faith community helps that individual, whether they stigmatize what happened to them or whether they respond and say, let's get help and help you through this. So that's my hope today, is that we move to that other option to where faith communities we don't stigmatize a lot of what's happened. Again, I see a lot of children who are blamed for what's happened to them instead of the other way around. So, I apologize for going over. Oh, yes, ma'am.
I just have one quick question. Maybe we go over to the next presentation, but
I'm listening. I'm just transitioning.
Just say, could be attributed to the fact that clergy have no repercussions as opposed to certified personnel who work with children or work with people, period. There are no repercussions for any damage that they might cause because our state doesn't hold them accountable in a professional sense.
Yeah.
They do other mental health
There,
providers.
there are certain protections. I think being in, I'm trying to get your computer plugged in, sir. That they have, I would say I've seen, it depends on the jurisdiction and the local, really the local prosecutor, what they decide to do. So going back to the Victory Christian, there was prosecution of the individuals in that institution at that time because they didn't report. But I think that there's oftentimes, exactly what you said, there's kind of this concept of, well, we can't really do anything to these faith leaders. So I think it comes back to, again, why you all are here maybe, and what we can do through the organizations here is to promote like what to do and what are the right responses. And maybe even going back to like theology schools and teaching it back all the way back then. And,
Training.
yeah, just training and kind of those concepts. So
Mandatory training.
Well, that's why we're trying to get all of our faith leaders and our lay leaders in our religious places of worship trained, trauma-informed trained, so we know and we'll be able to recognize who high court and next agencies. So that's kind of our goal.
Thank you.
Thank you very much.
Thank you all so much for your time and thanks for being here.